Today on Cancer Buzz, an ACCC Innovator Award-winning program that improves patient access and treatment of endocrine immune-related adverse events. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This summer, Cancer Buzz is highlighting the 2023 ACCC Innovator Award winners. The ACCC Innovator Awards highlight cancer programs that have developed solutions to improve patient access, quality, and adoption of value-based care. Our guest discusses how telehealth and virtual care models have improved patient care and the patient experience and reduced healthcare costs in her own cancer program. Dr. Afreen Shariff is an endocrinologist, Director of the Duke Endo-Oncology Program, and the Associate Director of the Cancer Therapy Toxicity Program at the Center for Cancer Immunotherapy at Duke Cancer Institute.
When we started thinking about these kind of different care delivery models, we really were doing this in the pre-COVID era. And it was the right time to implement it because we started working on it in 2019, believe it or not, and then COVID hit. And it made a lot of sense to have these kind of care delivery models in a very virtual era where we had a lot of difficulty getting the right patients in, even to see the doctor for the right reasons. So I believe there has been a shift in practice and a shift in acceptance and adaptiveness of both patients and the healthcare system in general to these kind of delivery models.
How can you ensure adequate reimbursement from payers for these types of e-consults? Is Duke negotiating?
Yeah, this is a very important question. I've been a strong advocate for the what I call effort and reimbursement mismatch, because these are very different technically from the traditional e-consultative services. So traditionally, e-consult services are between primary care and specialty practices. And the idea is that they are able to give recommendations to get people in the door who need to be seen and not see the patients that don't need that kind of expertise. So that is the idea behind traditional e-communications or e-consult models. But this is a little different because this is an acuity-based specialist to specialty consult service that goes from an oncology service to an endocrine service. So the acuity of patients that we see is different. The level of expertise that is needed to triage and give recommendations on these patients is different. So I've always advocated for a higher reimbursement than what currently exists. Now, when we look at the reimbursement models that have worked for us, we actually have an internal reimbursement structure that works for each consult. So we get reimbursed individually for every consult that we do. But the reimbursement through third-payer parties is what I call it the coffee and bagel consult, because it really doesn't do much as far as payments is concerned. And I think we get paid about $25, $22 per consult, which really doesn't do justice to the kind of service we provide.
How have you seen telehealth improve health disparities for rural populations or those who face transportation challenges at Duke?
I think the most important thing is when we look at it from an access perspective. If you have 100 patients that an oncologist believes, say, needs to be seen by endocrine, when we review the cases, we say about 30% of these patients don't really need to be seen. So that really takes away from the aspect of these patients traveling far for a service that they probably don't need or don't need that kind of expertise. And what that does is because 30% patients are not flogging the system, then you really open up access to those patients who really need to come in and have to be seen by that expertise. And it allows patients to get care even before they're seen, which is the charm of doing e-consults, is that recommendations are actually made within 24 to 48 hours. So even if I'm not seeing someone who lives 5 hours away, I'm able to put in recommendations and things can be done locally and lives can be saved and patients' treatment decisions can move forward even without them having to step foot in my clinic.
How has your team adapted in order to efficiently deliver this new care delivery model?
So it has been an iterative process. As I mentioned, we started this somewhere in the peak of COVID, which was in 2020 May. That's when we actually launched the service. And it has been an iterative process. We've done about 300 plus of these consults, and we've realized that we needed to basically educate oncology providers from different disease groups, which was a challenge because we work with different disease groups, and different disease groups have different administrative leads, different administrative pathways, and they function very independent of each other. So it was important to educate providers, especially with the increased turnover that we were seeing, to utilize these kind of services, because that, again, can be a disconnect where we have these amazing services, but if oncology providers are not aware of this, it really doesn't translate to great care. So educating providers, trying to understand what makes it easy. So we've done assessments of provider satisfaction after we've done these electronic consults and sent it out to oncology providers who've used our service and gotten feedback from them about what has worked and what has not worked for them. And in a majority of cases, we've had excellent feedback. In some of the cases where we've had constructive feedback, we've really taken that seriously and made improvements in our process.
Dr. Shariff and her colleagues will be at ACCC's 40th National Oncology Conference this October to present the Duke Cancer Institute's implementation of e-consults for patients experiencing endocrine immune-related adverse events. You can find a link in the show notes to register for that event, held October 4th through the 6th in Austin, Texas. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.